Hello there. Welcome to all our collaborators. Thank you for joining us for this washout webinar. People are just coming in as we speak, so I might just give a minute or two for all the attendees to sign in. What I'll do first, whilst we're waiting for that, is maybe make some introductions. So I'm going to ask everyone here that you can see to introduce themselves, and then we'll just stick to the panelists for tonight's webinar. So Aqua.
Yeah. Hi, everyone. I'm Dr. Asif. I'm part of the WASHOUT steering committee, been part of Burst for several years now. I've just finished my academic foundation program, and I'm an aspiring urologist. Happy to stay in the background whilst we have this amazing webinar.
Thank you. Raghav?
Hi everyone, so I'm Raghav. I'm currently in SD6 in urology, just taking time out doing a PhD in London School of Hygiene and Tropical Medicine, and also part of BEST. Very much looking forward to this webinar.
Quentin?
Hi guys, I'm Quentin. I'm a foundation year 1 doctor, so just graduated medical school. I'm the Burst secretary, and I'm also part of the WASHOUT steering committee, so I'm one of the people answering your emails.
Okay, Bing.
Hi guys, I'm Bing. I'm a final year medical student at Boston, London, and I'm also part of the washout steering committee, one of the members, and also just one of those that have been answering your any queries you have from the emails.
Thank you. Nikki?
Hi everyone, I'm Nikki. I'm a final year medical student at King's, aspiring urologist, also part of the washout steering committee and helping produce some of the media assets that hopefully you will have been seeing online.
Simona?
Hi, my name is Simona Ippoliti, and I'm part of the washout steering committee as well. And I've just completed my surgical training, and today I will be talking about a bit of support in washout.
Kevin?
Hi, everyone. Nice to meet you all. My name is Kevin. I'm a North London trainee and one of the leads for WASHOUT. It's nice to see the room beginning to fill up, and I'm looking forward to sharing with you some of the study, and also maybe putting some faces to the names at the end of the session as well.
Thank you. Nikita?
Thanks, Sanan. Hi, everyone. I'm Nikita Bhatt. I'm a post CCT trainee fellow. Still have a habit of calling myself a trainee. Going to start my fellowship in Newcastle, and I am co-lead for WASHOUT with Kevin and past co-chair of Burst with Sanan. And thank you everyone for joining, and also many thanks for actually collaborating with us on that study. Pleased to see you all here.
Good. So I think that's bought us a few minutes for people to join. So finally, I'm Sinan. I'm also a previous co-chair of Burst, and I'm going to help chair this session. So welcome to everyone, whatever time of day it is for you, as this is an international webinar. I'd like to especially thank our Burst team who've been working hard in the background to run this webinar smoothly. Special mention to Aqua, Alex, Nikki, Quinton, and Bing for their hard work. And of course, Nikita and Kevin for leading on this amazing study. So just a few quick housekeeping rules. The webinar is recorded. This is so that we can put it on our YouTube channel and other people can benefit from the questions and answers. Due to the number of attendees, we're not giving attendees any video or audio. However, you can interact with us as much as possible by discussing and submitting your questions, which is very much encouraged. You can submit formal questions that will only be seen by the panel in the question and answer box, or for general discussion, we'll also be monitoring the chat function. There's a team there specifically to discuss with you and bring any significant or interesting points out for the panel to discuss. So we want this webinar to be as discussive and interactive as possible. We're going to start with 2 short presentations from Nikita giving us the background on the study, and then Kevin will talk about recruitment and any issues with ethics, and finally Simona will close off with support. There'll be time in between these talks for questions and answers and some open discussion. This should all take about 35-40 minutes, and at the end, like we did with previous webinars with Resect, we'll stop the recording and then we'll invite any attendees who wish to stay for a more social discussion to stay on the call, and we'll give you video access and audio access. So you can just put your hands up like a normal Zoom meeting and ask questions. So without further ado, I'd like to hand over to Nikita, who's going to just go over the washout background. Nikita.
Thanks, Sinan. I'm just going to share my screen. Hopefully you can all see my slides. So yeah, I'm just going to go through the study background briefly, but I'm sure a lot of you are familiar with washout because you've been kindly collecting patients for this study. So why is this important? Well, inpatient hematuria is quite a common presentation. The patients affected are quite elderly, comorbid and vulnerable. The single kind of center studies that have been done so far have shown that their average length of stay is quite long. They have a high readmission rate. A lot of these have underlying cancers. They have a 5% 30-day mortality. And secondary to all this, there's a high resource utilization as well. So this is an opportunity where we can diagnose these patients with an underlying condition in a timely fashion and treat them. However, in a lot of places across the world, anecdotally, this is not being done. So why did we think this was an important area to do the next first study in? That's because there's no high quality data to guide our practice. The practice is likely very variable, not only across the UK, but worldwide. And hence there's a need for a consensus as well as standardization of practice. We did some Twitter polls ahead of our annual BOWS meeting in the UK, which suggested that the way that people manage radiation cystitis and other conditions related to inpatient hematuria is extremely variable. And again, this underpins the fact that there is no evidence guiding our management in these scenarios. So we began planning for washout early 2023, and just to give you an idea of how much work goes in behind the scenes for these studies, we had a planning phase initially with a PPI panel that we involved for all our studies. There were 10 patients who gave us their input in designing the study. We peer reviewed the protocol with several international experts. We had statisticians and methodologists give their input. There's a health economist on board, and we have a redcap CRF design that you all have been using. And this is a service evaluation in the UK. The ethics in different countries is quite variable, and we'll talk through this briefly in the following presentations. So this is an international multi-center observational cohort study with an aim to describe the management and inpatient course of these patients, the trends in their diagnosis, identify variations in practice, and then associate these with key outcomes, which include length of stay, mortality rate, readmission rate, resource utilization, and time to diagnosis. We have our brief protocol available online, and we're in the process of publishing our first paper, which will be our protocol, hopefully soon in the near future. So the eligibility criteria, which is the important bit, is anyone who is an adult over the age of 18, presents to a secondary care center, has to be admitted with emergency hematuria, under the primary or joint care of urology. So we'll clarify this a little bit more in this webinar because we get some questions about this. So if someone is admitted under a medics on a certain date, but urology were not involved at the beginning, and then they developed hematuria and urology were involved later on, these patients unfortunately cannot be included because we want them to be included from the time of admission when urology was involved with the hematuria. So just a question that has come up quite a few times. And exclusion-wise, any trauma from catheter insertion then causing hematuria is excluded, any abdominal pelvic trauma is excluded, and unfortunately, anyone who is not admitted in hospital or was in hospital for less than 24 hours is excluded. And we have discussed with several of our collaborators who have different protocols for managing these patients, and they are unfortunately not being admitted, or fortunately not being admitted in hospital, which is a good thing, and are being directed into urgent outpatient care. But unfortunately, with the current way the study is being designed, these patients cannot be included for this CRF, and we are thinking we might do some post-study surveys to try and tease out the way these people are being managed in other countries, which would be quite good as a learning point for us. Requirements-wise, if you want to take part in a single center, you just need a minimum of 15 patients in a year, and this is including only one collaborator and a supervising consultant. For every extra collaborator added on, you need 10 more patients. So we're currently in the prospective patient data collection phase, and after that you have a follow-up phase. We have kept the follow-up of this study quite short at only 3 months, and we're hoping that everybody is able to collect their follow-up data quite quickly because it is such a short interval. The sample size has been calculated using expert statistician input, and we are hoping that we get a minimum of 1,050 patients. However, Kevin will tell you how many we've recruited already, which is a testament to all your hard work. So we're very, very grateful for that. Like I said already, it is a service evaluation in the UK, and we have several representatives internationally and national coordinators that will assist you with ethics in your country or city, and we are going to briefly touch through these ethics process and how to get support in the last talk with Simona. In terms of other support for this study within the UK, the BAUS group as well as CURFT are endorsing this study to sort of streamline management of these patients. And we have several innovations within the study design as well. If you look at the REDCap, we have worked really hard to keep the patients anonymous. So all the time data points are non-identifiable, which means that REDCap automatically is storing the difference in dates based on what you put in as the admission and discharge date, but does not store the exact calendar dates that you are adding into REDCap, which will allow the patient to be completely anonymous. And we have a Slack group to answer any collaborator queries. We thought this was an easier way to access our study team as opposed to emails. And Simona will tell you how to get in touch with us through the Slack group in the following slides. And finally, we can check your data quality as you go, thanks to the data quality app that was innovated initially through Resect, and we're now using it for WASHOUT. So you can actually check how the data you're entering is doing in terms of quality and correct any mistakes now, as opposed to having to go back at a later stage and doing that. And Kevin will give you a demo of how to do that in his talk. Thank you very much.
Thank you, Nikita. There were a few questions, 1 or 2 questions starting to trickle through, I think, just about what you've said. Raghav, anything from the floor?
Yeah, so we've had the one question from the floor, which we've answered, but I'm just going to ask a few questions from sort of the emails that we've had submitted before the webinar. So we've had quite a few questions regarding people changing hospitals and being in rotations. And the main question that's come up a few times is, how can I stay as a lead collaborator if I'm moving hospitals? And I'm hoping Nikita can answer that for us.
Thanks, Raghav. This is a tricky one. And we've tried to time the study such that it's doesn't fall into a changeover period. However, if you want to stay a lead collaborator in a site that you've started the study in, ideally you should be able to still collect data and play the part of a lead collaborator in that center, or else start the study afresh in the new center. However, there is a potential that you can discuss this with the remaining collaborators in your previous hospital to see if you have contributed enough to continue to stay as a lead collaborator. And this is something that you can discuss amongst yourselves and decide. So the contributions such as making sure the audit committee was informed and the study was set up, having a key in place, etc., would count as significant contributions to continue to stay on as a lead collaborator if the others in your center were happy.
Perfect, thank you. And just one other, this is regarding more to do with the study itself. And this is, what is the time frame for this study? And when can we expect to hear the results of our data collection?
Yeah, so we're hoping that we get enough number of patients to close the study by the end of this year. We haven't got a exact time set yet, but it'll be probably December this year, and follow-up data collection will stay open until early next year, and we will hopefully start publishing and presenting abstracts for EAU, AUA, PAUS next year of the initial data. And then, as I said, the protocol will be published soon, and the first few papers will hopefully start coming through in 2025, early 2026.
Perfect. Thank you very much.
Thank you. Okay, so I'll move on swiftly and give Kevin the floor to introduce how we're doing with recruitment and going through a live demo.
Thanks very much, Sinan. Next slide, please. So since opening WASHOUT, we've had a lot of enthusiasm from international collaborators, and it's been really great to see that from the very first registration form back in January, it's steadily increased over time. And currently, we have on the site over 400 live collaborators with approximately 300 hospital sites registered and ready to go with entering patients. Many sites have already entered a lot of patients. And as of today, we have about 1,300 patients in the study database. So as of yet, we currently have enough to fulfill our power calculation, which is really good. But each additional patient that's entered and more power is given to the study. And that's really important to allow us to answer questions at national levels and also regional levels. Next slide. We've got quite a global reach with this study, and pretty much every continent except Antarctica, you could say, is covered by it. It's largely UK based, but there is a really good coverage of sites across an international basis. So this is really positive, and it means that the results of the study that you're contributing to will have impact internationally. On our website, there's a leaderboard, and some sites have been really successful so far in entering sites. This here gives an overview of the top 10 sites that have completed follow-up cases. So many of these are UK based, but if we move on to the next slide, we can see that when we look at a total number of cases that have been entered but haven't yet had their follow-up data entered, we have a lot of more international sites. And again, as we go through this leaderboard onto the next slide, we can see exactly how it's shown on the website, the amount of patients that are currently being recruited internationally. Next slide. And again. Here are some important links and points of contact for the study. The most important one probably being our website, where you can get all the study documents, particularly if you're new to the study and want to get started. This is a really good starting point. There's also our email, which is washout@burstsurology.com. So if you have any questions or queries, that's a good point of contact. We usually answer them within 2 or 3 days. So just touch base with us if you need a hand with anything. I'm going to now, final slide is just to say a massive thank you to a really large team, everyone who's put in a massive amount of hard work into this project. Many of the people who are on this call have done loads of work in not only getting the study off the ground, but also maintaining it. And they're often the people that you've been in contact with. So really hats off to a great team, and also the support staff, both statisticians, steering committees, peer reviewers. They've all been really helpful in developing this study. Next slide. So now we're going to do a live data entry. If you want to stop sharing screen, and I'll start sharing it now. So can everyone see my screen? Great. So the first section I was just going to show you is the Burst website. This gives an overview of the project. If you go to project and drop down to washout, on this page should really be all the information you need to get started with the study. So if you're visiting us for the very first time, you can find a link to the hospital registration form. It gives a brief background on the study, as well as the link to the Slack channel. So if you haven't joined the Slack channel, you can use this link to download the app and then join on the messaging app and meet with other collaborators working in your country. And also it's a good point of contact for contacting any of the Burst team. On this page is also some useful videos. We have an overview of international sites. So this is good for checking if you've had your site already registered, and you can contact a point of contact at your site if it's already registered. The leaderboard is here too, and you can interact with the leaderboard. You can go through and sort by follow-up cases and number of cases, as well as searching for particular collaborators. And again, if you're just starting this, or maybe you've moved hospital, this can be really useful to find out who is the person at the hospital you've just moved to who's running the study, who to email, and who's the best point of contact locally. There's some study documents that you'll need for following local approval processes, and also a short video, which goes into a lot more detail of what I'm about to do in the next few minutes. So that's a website. It's a good point of contact and useful few resources to get you started with data entry. And the other useful point will be a email, which will now be going out on a fortnightly basis. And this email contains a lot of important links individual to each of the collaborators. So for example, it will give you some breakdown of how many cases you've entered, your current ranking internationally. And if you want to get on mainline authorship, this can be really useful to give you a metric as to how you're doing internationally, and see if you can get up into the higher deciles to get on mainline authorship if you're one of the highest recruiting sites. You can log in to the REDCap record overview, and you can use this link. If you've signed up a few weeks or months ago and you've never actually logged in for the first time, or if you can't find your login details, just click on this link and click reset password. That will allow you to log in. There is also links to the site collaborators form. If you click this link, here's an example of the site collaborators form, and you can add and remove collaborators as needed. Now I'll move on to a very quick overview of the REDCap database. So once you log in, this is the home login page. The important links to know about is the record dashboard. This will show you an overview of records that you've entered. Now, usually these records that you'll store locally, and then you'll allocate it to a local hospital number. If you want to get started with a new record, you can click add or edit record and then add new record. And just for the purposes of demonstration, I'm going to show you a few key points of the data entry form. here we can see on form 2 is a date calculator. So for example, if this patient was added on the or was admitted on the 1st of July 2024, you enter it just in this format. And let's say, for example, it's discharged on the 1st of the 7th or the 5th of the 7th, 2024. When you enter that, this date calculation will come up. You'll have to answer yes if the calculation is correct, and then you can move on with the data entry form. Now, it's important that every time you leave the form and then go back to it, these data points will be lost, and that's for to keep the individuals anonymous, meaning that the only thing that's stored is the length of stay. So this number here is stored, and if you want to change it, you'll have to re-enter both the admission date and the date of discharge, and this applies to every single date calculation in this REDCap form. On form 2 as well, as you go through all of the baseline data that you'd collect on admission, you'll also at the end of the form be prompted to manually calculate the length of stay. So when you, if that matches the above length of stay, then it will unlock the next form and you can move to the next form. Once form 3 is unlocked, and that's what we're currently on, usually it will stay locked for 90 days. And that's because the record dashboard here will gray out this area, and that's to stop you from progressing to enter follow-up data before 90 days. However, let's say if you retrospectively held the record and then wanted to go ahead and enter follow-up data earlier, you just click this box. This unlocks it, and then you can go on to form 4. And then once again, you can go through this form, entering all the data, and go on to form 5. And to progress through all the forms, you have to make sure that there's the minimum data set on each form. So for example, here, this is grayed out because there's something missing in this form that prevents you from stopping it. So if you go to this form, you'll find something that's missing here. So it could be that the calculated amount of days is incorrect. So you need to double check that you have everything correct. If you're unsure and if you're struggling with how do you find what's correct and what's not, or if you're trying to track down an error, you can go back to your email. You can click on the link to go to your data quality app. And then once you're in the data quality app, you put in your site ID and your pen. Then it will come up with all of your records, and on the records it'll identify. So on that form, it was we were missing the whether or not the patient was admitted to ITU. And if you click on this, it'll go straight to the data point that you're missing. So again, the really important places to go if you're feeling a bit lost are firstly the website, if you're just getting started, and if you're a regular user that's either hoping to add new users, the site collaborator form or the data quality app, go to this email. We'll be sending it out on a 2-weekly basis, and we really hope that both of those give you a lot of help with getting started with data entry. So I'm now going to stop sharing my screen.
Thanks. Thanks, Kevin. That was a really thorough demonstration, and really, really amazing to see how many people have recruited already. And as Kevin said, even though we may have the number for the power, it's great to get more numbers represented from different countries so that we can see the variety of practice from each country. This is a collaborative project, and even though there's enough data to get the primary outcome, we want to learn from each other. We want to learn who does it best, what is the favorable pathway for these patients. Kevin, there was just someone from the floor that was interested in just quickly seeing how much data they're supposed to enter for one patient. So maybe you can just quickly reshare and click through your instruments just to show them.
Yeah, 2 seconds. I'll just so yes, this is the so if we go to add record, we can see this is a summary of all the 5 forms. So the first form will have admission details. The second form is all about management and outcomes. You'll have a quality check, and that becomes unlocked when you have the minimum data set entered, and then you have the follow-up outcomes in form 4. So if we click into the first record, we can see that firstly, you have to click yes or no to all the inclusion criteria and the exclusion criteria. If you answer incorrectly to any of these, you'll then be prompted with an error message. You won't be able to progress. But the basic information is on form 2. So you'll enter the year of birth, the biological sex, the type of hematuria, the type of presentation that they had. Were they septic on coming in? Did they have any signs of infection or upper tract obstruction? This is a clinical frailty score. So again, this is a good kind of display of the patient's fitness and a descriptor here. There is a few more questions about the baseline of the patient on entry to hospital, as well as a Charleston comorbidity index. This in particular is a really important part of it because it can influence the overall index of comorbidity of the patient, but also influence how we analyze health economics here. So it gives us a good idea of the type of comorbidities that these patients get. So spending a bit of time on this section is useful. And then we'll go through particular pre-existing diagnoses, tick individual boxes, and I'll very quickly just show what's on the other forms. So management and outcomes is here, and that has the lab results from admission, ward-based management, medical management, and some of these will be relatively short if they haven't had any alterations, and if they have, then there will be branch logic from that. But again, it's really just there is a minimum data set that you need to enter to unlock the next form.
Yeah.
Scans, management, and the same is recorded again on follow-up form. So hopefully that gives you a bit of a flavor of the type of data that we're looking off of collaborators. Each form, I think if you know the patient well and if they've just been discharged, it should hopefully take a few minutes per each form, and we've done our best to try to keep it as brief as we can.
Yeah,
I'd just like to jump in there. Sorry, as that this form, even though when you go through it right now, it looks a little bit long, but a lot of these questions are optional, and you only have to answer a lot of them drop down, branched from the previous one, only if they have a certain condition. So on an average, if you know the patient, it doesn't take more than 5 minutes, I think, to fill out this form.
And don't forget, it'll be split into, so there's the original data and then there's the follow-up data down the line. So it's not like you have to put all 5 forms in at once. And like any of these studies, the more you become familiar with the layout of the form, the quicker your data entries will be. Raghav, are there any other questions from the floor?
No other questions that have come through yet. But I have a few technical questions, Kevin, that I can ask. So one question that's come up before was, I've recently registered at my hospital site and that I've had my RedCap account, but still not received my project access to WASHOUT. If you could just help these people, that'd be great.
Sure. So when signing up, or let's say if you're added to the site collaborators form, we only make new accounts on a once a week basis. So if it's on a Monday, it could actually take till the next Monday or Tuesday to get your account. If you feel like you've been missed, or if you feel like your account isn't picked up, what I'd recommend is two things. You can firstly email us or get us on the Slack chat, and then secondly, another good thing sometimes to try is if you just go to the link, the redcap link, and reset your password if you haven't used your account in a long time. That's often you'll have your account within 2 or 3 days. You just may not get an email notification that your account has been set up. So that's just something to keep in mind.
Perfect, thank you. And just to add to that, so the email will come up on our slides, but it's washout@bursturology.com.
Yeah.
That's great. Okay. I'm keen to leave some space at the end to open it up. So I'm going to move on to Simona, who's going to quickly go over how you can reach out for support.
Absolutely. First of all, thank you so much, everybody, for joining the webinar. This is a great time for everybody to ask questions. So we are trying to spot all the questions everywhere from the email flow, from the webinar chat. So please continue to ask if you have any questions. Before I go through the support bit, I would like just to share a very, very minor piece of advice that I actually used to collect data when I was leading Resect in my site. So I have been absolutely in your shoes. So understanding what are all the different data is, of course, important because that makes you be a bit faster. So what I used to do is to add the data in an Excel file. So after you try to complete the first case, the second, the third is going to be very, very fast. And sometimes I used to upload all together. And you can do big numbers when you become fast. So that's why I would like to suggest to you also, if you want to keep patient details after you've done a first case. So I'll try now to tell you about the support. We can move the slide. Thank you so much. So Kevin has been very, very comprehensive in explaining where the supports can be found. So I will just summarize again. First of all, we have our newly shining website, bursturology.com. In Washout project, you can find all the details. You can find, of course, all the, not just the leaderboard, but also the documents and many other things that can be interesting for the specific problem that you want to solve. You can also email us at washout@bursturology.com. We usually answer quickly or fairly quickly. Keep just bear with us if we don't do immediately, but you can always use another channel that is the real-time communication platform, is the Slack channel. It's called the WASHOUT workspace at slack.com. And another thing is, if you have problems in your specific site from Italy, China, Brazil, or Spain, wherever, if we have an international representative in Burst Urology, we're willing to put you in contact with them. So you can always pop an email at washout@bursturology.com, and we will guide you towards the best person if we have one. Thank you. Let's move on the next slide. So this is the QR code that we created for you for the Slack channel if you want to join. Alternatively, you can also join directly from the website where Kevin has shown you. And finally, let's move to the next slide. You can also use redcap-support at ucl.ac.uk if you have any problems with the redcap. So for data entry and management, they are also helpful in helping you. In Washout, instead, we usually, in the Washout email, we can provide definitely some support regarding the registration process and the ethics approval, collaborator registration, but most of these things can also be found in the website. So I will prompt you to go to the website first, and then if you wish, of course, pop an email and we will try to answer as soon as possible. And thank you so much. So very last thing, of course, we are always happy to hear if you have any feedback. It's not just to ask questions. The washout email can be used to provide feedback about the project, how you feel about it, and improvement. These are all valuable information that we can that we always cherish and share with the world, really. So we're always happy to hear from you. So thank you so much.
Thank you, Simona. Thank you all for coming to this webinar. I hope you found it useful.